Here we are. I'm fascinated by the creative process that is going into this from both of you, really, with upstage lung cancer, with interviewing people, with creating a living room. Um, and you're telling me the stories are so unique and diverse. Is there a common thread though between the stories as well?
I think
Hildy,
there
John, go ahead.
there is definitely a common thread. I think there is, I mean, hope is one of those. Resilience is, I'd say, the number one. Overcoming. Um, the one thing all these people, and well, we must include Hildy in that also, is the resilience it takes to, when you hear, as Bonnie says, I want to quote Bonnie, when you're in a meeting with an oncologist or a doctor or a surgeon, and after they say the phrase lung cancer, you don't hear anything else. Because lung cancer has for so long been a death sentence. And it was always perceived as the orphan cancer in the sense that you got it because you asked for it. You smoke, so you got it.
Right. A huge bias.
Only 30% of lung cancer patients are smokers.
Yep.
The vast majority either gave up smoking decades, or it is something they just got, and it's not an old person's disease. It's not just a woman's disease. Young people in their 20s are being diagnosed. And what drives Bonnie is to let people know that they shouldn't be ashamed of having lung cancer. Bonnie tells a great story about a woman who said, I'm dying of lung cancer. Look, smoking is killing me, but I never smoked because people viewed lung cancer. You don't have to give money to lung cancer because nobody has to get it. Wrong. And what has changed because of people like Bonnie Addario, the entire web around lung cancer has changed. The greatest drugs in cancer research are now aimed at lung cancer. But here's the great thing, Dr. Joe, and then I'll get back to the question about what unites these people. The drugs that are coming on the market to treat lung cancer, like Keytruda, are now becoming first choice drugs for pancreatic cancer, oral cancer, colon cancer. These are immunotherapies, targeted therapies. What Bonnie will say to a recently diagnosed patient is, get your biomarkers checked. See if you are eligible for one of these cutting edge treatments. And to that point, perfect segue. Another thing that the people we profiled in the living room have in common is a desire to give back, a desire to spread what they've learned in their own experience, to become advocates for better treatments, for newer treatments, to give everyone their phone number. Bonnie Addario is head of the largest co-founder of the largest lung cancer foundation in the world. But if any lung cancer patient calls that office and asks to speak to her, she gets on the phone, or she calls back within a very short period of time. She talks to everybody because, again, and I think Bonnie does this for people, and then they go on to do it for others, Dr. Joe.
I was going to just, that's absolutely true about Bonnie. And, I think she obviously selected 20 people in this book for a reason. And I think the important thing here is not everyone's going to react to lung cancer in the same way. Not everyone is going to feel resilient. Not everyone is going to feel courageous. Not everyone is going to feel they have a support system. Not everyone is going to be in the same boat. But these 20 people, I'm sure she selected because they can be an inspiration. So I think it's important for people who may be affected by lung cancer or any cancer, or their families, if they don't feel like, oh, I'm going to go out there and do this, and I'm going to do this and that they're not second-class citizens.
Right.
I think it's what you were saying, Dr. Joe. We try to do the best people try to do the best that we can. We don't
Right.
always do our best, but I think for the most part, if you're feeling, like life has just knocked you on your can,
Yep.
um, that's how, you just do the best you can. So I just wanted to say the book is an inspiration, and that's why it's so important. And I think Bonnie and I share a lot. We loved each other instantaneously and continue to. And we're both like no nonsense, like we're gonna make this happen, people. And she's done like an enormous job. Upstage Lung Cancer is a smaller organization and very focused on these, on again trying to bring information, reduce stigma, because again, you have celebrity and then you have stigma. So if you put them together, it kind of neutralizes the stigma a bit. And so I think I was telling Dr. Joe before, we also, Upstage Lung Cancer, we started a podcast series ourselves this year. And I'm hoping people who are listening to this podcast, which is wonderful, will tune into Backstage at Upstage. And that Backstage at Upstage is on all the podcast platforms, but it's also on Upstage Lung Cancer's website. So that can make it easy too. But so we've had of the 5 that are out so far, one has been on Stigma. And part of it is just what you've been talking about, which is cigarettes. The American, Lung Association, it's, started out with good intentions, which is don't smoke and get lung cancer. But the inadvertent, side effect from that, or the impact was, well, if you smoke, you'll get lung cancer. If you don't smoke, you won't get lung cancer. And if you smoke and get lung cancer, shame on you. It's your fault. So we had a great discussion about stigma. We also had one on about celebrities, and Jordan Rich from WBZ Radio and I talked about, and with Rondella Chiesa. They're both like very well-known. I love them both. Great radio personalities, and we just talked a lot about celebrities who faced lung cancer and actually lost their battle. Larry King being one of the more recent ones, but Paul Newman and other folks. So that was a great show too. And yeah, so we talked about pharma. Are they friend or are they foe? We did one with, I thought I sort of heard that one of your sponsors was Candy O'Terry's. She was one of my first guests, she and Joyce Pulhaywick, and we discussed finding joy. So like everybody, I think that's in everybody's purview. Like, how do you each day find a way to find joy in life? So yeah, so, and then the other one is too young to get lung cancer. No, as John was saying, sadly, younger people are getting lung cancer. And finally, this coming Tuesday, we're going to launch our next podcast, which is about biomarkers. And everybody listening to this podcast tonight should know about biomarkers, because if you or someone you know, someone in your family is diagnosed with cancer, any kind, make sure you ask about getting biomarker testing so that you can get the best options for treating that cancer, which targets that cancer directly. So, yeah.
Yeah, I think the biomarker field in cancer is way more advanced than in psychiatry. It's much more difficult to figure out through biomarkers which medicine really you should use for depression, because it's so much more complicated. But the biomarkers for cancer, absolutely, it is such an important tool, so you can target the treatment that will give you the best chance. Absolutely.
Well, but it's also different because we're looking at genetic mutations of a tumor.
Right.
Whereas with depression, there's no, you don't have a solid tumor that you can take a biopsy and say, aha,
Exactly.
Why you have depression. I mean,
Exactly. Exactly right. Exactly. You know, there are so many layers to this, the stigma that you're talking about. There's no question that, you know, the idea if you smoke, you get cancer, so don't smoke. It doesn't mean, as you're saying, that if you get cancer, it's because you smoked. And yet that was the way the whole thing is twisted around. We work a lot in addressing stigma. Uh, because stigma, that's why I don't even use the word disorder, because disorder separates people into two groups, one group that is ordered and one group that is not.
right.
And that's certainly, and then we were astonished we have stigma. The other part I want to come back to is what you're talking about with giving back to other people and how that actually creates biochemical changes where you decrease a stress hormone called cortisol. And cortisol is inhibiting everything about healing. Cortisol increases your blood pressure. It's going to make your heart race different ways. It will retain weight on you because the stress hormone, ancient stress hormone, thinks there must be a famine coming up. That's why I'm feeling stressed. There's going to be a famine. So you begin slowing down your metabolism of fats. So you have obesity, type 2 diabetes, hypertension, all these different things that go along with stress. But when you give back to someone, you create a different chemical, oxytocin, not OxyContin, oxytocin, that feeling you get when someone says you're amazing. And that's a healing chemical. That helps heal. So I am not surprised that the people that Bonnie has chosen are ones who are giving back and who are still here, giving back, feeling good about it. And I say this from a whole different venue of substance use treatment, because that's exactly what we use and teach our folks. When you give back to someone, you're actually going to be increasing your oxytocin levels, and that's going to feel better than anything.
You know,
So
Doc,
I'll come right back to that, John, because I just want to say that my oxytocin levels go not just from you guys, but from our sponsors who continue to treat me with respect and trust us. We'll take our commercial break. We'll be back for the last bit of this show. Ben, take it away.
Stretch the kindness, rush with madness. Is it sadness or just a show?